Our last question is, what are some common obstacles they face or patients face in stress management? And are there any effective techniques or therapies that can be helpful to manage both stress and IBS symptoms with their IBS symptoms? So definitely stress is a main trigger and that can exacerbate symptoms or even have patients experience those symptoms. It's a gut brain connection. And we try to help people with finding medications and therapies that are going to help with that motility, especially if they have diarrhea or constipation. And then we work with the low FODMAP diet to reduce some of the pain and the bloating and the gas. But really, why is it that someone is experiencing symptoms one day and not the next day? And that's where that stress component really comes in. And that's also the most confusing part for patients to understand. So there's definitely a lot of stress management theories. Obviously, we can work with licensed counselors to work with cognitive behavioral therapy and getting to the root issues of our stress, or, to work on stress management techniques. But most importantly, I try to work on my patients with their coping mechanisms for stress and their daily response to stress management. And that's a really helpful tool, but also a very hard one that takes a lot of time that patients don't necessarily have the time to implement because it does take a lot of practice. So one of the easiest things I always recommend patients is that they just start to practice and implementing breathing techniques. There's so many breathing techniques out. And, you can download an app or go onto YouTube and watch different methods for breathing. I know yoga practices have a great explanation about different types of breathing techniques, but it's really super simple. Even something as simple as doing a 5.5-second inhale through the nose and exhale out of the nose, and really getting that full breath to decompress and just to decompress the central nervous system response. That is the easiest way to kind of deter how our gut is responding to our stress. So breath work is something that I always implement, and I actually will practice with my patients, especially the particularly stressful patients or intense patients that come into my office. We'll start our session just with, maybe 3 to 5 minutes of breathing just to get them to calm down. Most patients actually don't know how to breathe properly so that they can reduce that central nervous system response and their blood pressure. And once you get them learning to start how to breathe properly, they can implement it to start their day, in between their day, when they're faced with a stressful situation, or even to end their day. So to me, breath work is the easiest, cheapest, and most applicable kind of therapy that you can do for stress management, especially when we're in a situation where we're faced with stress at that moment and we don't know how to respond. Breath work is one of the easiest things that we can do. So I always encourage patients that we have to start managing our stress better, whether it's by how we manage our response to stress, whether we're reading books on different coping mechanisms with our stress, whether it's seeing a licensed counselor about dealing with stress from our past, and then also implementing breathing, yoga practice, meditation. There's so many different methods that have helped people find relaxation so that their gut doesn't have to take the brunt of their stress. Thank you for your time today in discussing IBS. I appreciate you listening to me. If you have any concerns or would like more help navigating the low FODMAP diet for IBS, please reach out to us. You can visit our ADH website page and go to the Wellness tab, and that's where you'll find our nutrition email so you can contact us or me or my other dietitians on staff. Remember that IBS is not just about our symptoms, it's about managing it through food as well as our stress and your doctor's recommendations. So it's definitely a multifaceted approach to managing your symptoms of IBS.